I'll start, because this is something that obviously we've been thinking a lot about, and the days that we started to implement the orders and the controls that we've put in place, we started to think about what would it take for us to go back a little bit, a lot, a little bit in some areas, more in others. What would it look like for us to try and get back to some of the activities that we have? Realistically, and I've said this before, we are going to be in some form of having to monitor and prevent transmission of this virus until we have a vaccine, or until enough of the population is immune to it that it's no longer infecting people. But we know that that's a very high number. So a vaccine is something that we need to really, really push for. We are likely in our first wave right now, and we're watching what's happening in Wuhan, for example. When movement is starting again, restrictions are being lifted, and we have to go back to a different way of thinking. So when we get through this wave, which will likely be in another few weeks, it may be into May for sure, we need to start thinking about what does it look like again to understand if we're starting to see importations again, if we're starting to see clusters and cases being transmitted in the community. So we'll be going back to, likely, a very similar scenario to what we were about 6 weeks ago, when we were doing very active public health follow-up of anybody in the community again. We'll be doing testing on a different strategy again when we're in that place. So those are the things that we want to think about, but I do think it's more and more less likely that we're going to be able to get back to full normal life, which I miss a lot, before at least the summer. And then we need to start preparing ourselves for the potential of a second wave in the fall. In the meantime, we need to put every possible effort into development of a vaccine.
I think what I said a week ago was there was zero chance, none, that any of the orders would be varied by the end of April, and that's apparent that that's the case. What it looks like in May or June or July is harder to say, and a lot of it depends on whether people are committed, as I believe they are, and I think we've seen that, to responding with a 100% effort to bend the curve. But this is going to be challenged for a long time. I think I've consistently said weeks, days, and weeks, and months. And I think that's true. But I would say it's still zero chance before the end of April. And I think in terms of any of the orders being suggested, a similar kind of chance, little to none, in May or in the immediate weeks after that, after May. I think we're into this for a long time. And the challenge, and I think Dr. Henry's talked about this, the challenge of what would happen after that, and we'll be happy to meet that challenge if we are able to address this well or better than as best as possible over the next few weeks. That will be a major challenge to face as well. How one moves from where we are now to the next phase is going to require a lot of work, a lot of thinking, and a huge challenge. But for right now, we need people to be 100% committed, all in, and it's going to take a while, and people are going to have to be patient. We're not even in April yet, although we're in April tomorrow, and these next couple of weeks, as Dr. Henry has suggested, are some of the most important weeks so far, will be incredibly important to see what happens in the next couple of weeks, and we've all got to be fully committed. I know that everybody working in healthcare is fully committed, but as for the future, still zero chance for the end of April. The chances after that are challenging as well.
I haven't given up entirely the hope that we might get a reprieve during the summer, as we do with influenza and some of the other respiratory viruses, although how much of a reprieve is yet to be seen, and I've been watching Australia and New Zealand very closely to see what's happening there and the transitions there. I don't believe that we will have all of these restrictions for that period of time. What I do know is that this is a critical part of our first wave. And we've seen that, the infectious disease outbreaks do come in waves. They don't just continually there's many different factors, but part of it is how we respond to them. And we've seen in other countries that we do reach a peak and we start to see things coming down. We've seen that in China. We're seeing it hopefully now in parts of Europe as well. So we need to hold the course right now. It's incredibly important that all of these distancing measures that we're doing to build those firewalls in our community and allow us to find those outbreaks in the community, to make sure that people who are sick enough are able to get the hospital care and the critical care that they need. That's where we are right now. I don't think we need to be this locked down, if you will, for many, many months. As we said, the next few weeks are really, really critical. And then we need to think about how to do that in a thoughtful way that allows us to get back into some of the critical things that we need in our lives to be part of our community, to support each other. But I do think it's really important that some of the things that we're doing now are going to be needed for a time, and being comfortable in how we can support each other virtually, how we can continue and maintain those social interactions virtually without the downside impacts that we know that this type of isolation can lead to. So right now's our time to try and come together to support each other, if not physically, but at least to do that socially and virtually.